Good day, everyone. It's really great to see all of you, and it's a very warm welcome from Harvard Business School. This is one of the series that we are managing in the club of the GCC. We have a healthcare sector of experts working in healthcare in order to have some initiatives to help to the region improve patients' life. And today we have a very exciting topic with two very well-known and recognized experts on this topic, diseases and brain health in all our patients. And for that, we have the privilege to count with the journalist expert in healthcare, Rachel McArthur, and also our neuroscientist, Dr. Malaz Boustani, who will have some time to explain all the things that he is doing on that. So I hope that you will enjoy that, and anything that you will like to go deeply on that, you can count with the Harvard Business School to reach to us and see how can we support in all the things that is happening, Rachel, in this. Rachel and Dr. Malaz, thank you very much for accepting the invite, and I hope that we'll have a wonderful conversation.
Thank you very much, Alejandro, and thank you so much for the warm welcome and the very generous introduction. You know, I never say I'm an expert or anything like that. I am just basically being the gateway to your amazing stories as experts yourself. So it's a great privilege for us to be joined by such a renowned name in the world of brain health as part of Harvard Business School. Dr. Malaz Boustani, welcome. First of all, I have to ask, how's it going for you today? It's quite early for you. Thank you for joining us here. It's Dubai evening.
Oh, thank you so much. I'm doing well. Thursday is my thinking day. So today I will be interacting with ChatGPT to really think about scientific stuff. So today it's the fun day in my week.
So it's appropriate then that we're meeting about brain health since it's your thinking day, right?
Yes,
what a great day to meet. Now,
yes,
look, like I said, you really do need little introduction. However, since we're also showcasing this video interview to the public in the UAE, the Middle East, and North Africa and beyond, for those who don't know and don't know your areas of expertise, now, mashallah, you know, on your LinkedIn profile, you've got multiple job titles and roles. So for those who don't know, can you just give us a little bit of an overview about what you do day to day?
Yeah, so fundamentally, I am a scientist, so obsessed about finding the truth, but I'm specifically an agile scientist, which means I don't want to just observe and find a phenomena and identify the truth. I want to make sure that I can transfer that truth to action that will change human lives, in particular. And within that space of science, I focus on the brain. So I'm an agile scientist, an agile neuroscientist. And why the brain? Because the brain, to the best of my knowledge for now, is the only organ that I can't do transplant yet. And if you lose your brain, you lose everything. I can do, not me, but the entire scientific community and the healthcare community can do lung transplant, face transplant, kidneys transplant, heart transplant, liver transplant, but we can't do a brain transplant for now. Protecting this precious organ, it's number one priority for me. So I want to use science in a way to transform brain health for better for all now. So that's as a scientist, but I'm also a physician. So every Monday I go and trying to translate these kind of scientific discovery to some of my patients and go from there.
And this is the crucial area, right? Because as you know, the community ourselves, we go to a lot of conferences. I'm sure you meet a lot of colleagues in the field. You share research, you share data, you share advancements, you share the latest what's going on in research. But today we're really here to kind of break it down more for the general public and the brain health and just the little things really to take care of your brain health. You mentioned GPT, which I'll get back to in a little while, because that's been in the news connected to the brain recently. But first of all, now I noticed on your LinkedIn, you have a mantra as your cover picture that says there's no health without brain health, right?
Correct.
So speaking to your patients, to the general public, just what is brain health? How do you actually define it?
Yeah, so I'll tell you, every Monday, we have a special spot in our clinic where we call it family conference. So patients and their family, they come over and then I have to disclose information about the brain health of their loved one and work with them on designing a brain health plan. Okay. And then I hand it over to my team to execute that plan and personalize it. So I'll tell you what I tell my patient and their care partners. All right. So I tell them the brain has 4 functions. okay? The main one is keeping you alive. And usually the people who I interact with on Monday, they are alive. So that one, I don't have to worry about it. But in other setting, obviously that's a big issue. So the brain is responsible for your life. And that's a big change. 100 years ago, we thought the heart is responsible for your life. Right now, we define death by your brain status. If you're brain dead, then you are dead. Okay, so that's one function of the brain. Then on top of it, there are three pivotal tasks of the brain. In a simple way, we call them. I'll start with the typical one, which is keeping you moving. All right. So even though the brain doesn't have any muscle, it doesn't have any bone, but it actually gives the order for your muscles and your bone to move, including the muscle responsible for your talk. So we call that movements. So the brain is responsible for your movement indirectly. And then on top of it, the brain is responsible for your emotion, what your feelings. So feeling angry, happy, contained, anxious, all these function of feeling is the brain function. And then finally, this is very unique for a human in general, more than anything else, the brain is responsible for your thinking. Okay, so these are the four types of the brain. I specialize primarily in your thinking and your emotion. In particular, because for me, I think thinking is so crucial for your survivability as a social being. If you don't have a really good thinking, you can't solve problem. You're not going to be able to maintain your living situation, your social functioning. You're not going to be operate as a person with a specific goals within the society. So that's the way I introduce brain health. Is the thinking number one priority? Emotion obviously is important. Don't forget about the orders for your movement. And finally, obviously, if your brain is dead, then you are officially dead. So that's one thing I mentioned. The other thing I mentioned to them is what I open up the conversation with you already, which is unfortunately the brain is very, very precious, and you have to protect it, and then we go from there.
So, first of all, in my years of doing this, I've never actually ever thought of the brain as, oh, there's no bone or muscle. I've never thought of this. And even just describing it in that way is so fascinating, right? That this is what controls everything else. And it controls the good decisions, the bad decisions, the emotional decisions, etc. So what as a patient, if I were a patient coming to you, what would I be coming with? What are the general problems or issues affecting individuals at present?
Yeah, so most of the people, there's two categories of patient they come over. The dominant category for us, patient coming over with symptoms/problem in their thinking or in their emotion. But most of the time, because we are memory care or thinking focused clinic, the main reason is coming over with thinking. Okay, now I'll come over to kind of dissect the thinking. Sometimes they'll come over with emotion, a problem, and very rarely they come over with mobility problem there was no muscles or bone related issue. All right. For example, like mobility caused by stroke or mobility caused by Parkinson's disease. But for us, we really thinking focused. So people come over, they have their own concern about their own thinking, but most of the time, unfortunately, their care partner is coming over and say, I have some issue with the thinking of my loved one. All right. So what are under the thinking parts? The thinking part, most of the time, they come over and say, they don't remember what I told them an hour ago, 2 hours ago, 24 hours ago. They are not making the right decision. They are becoming victim for a spam or for scams. I don't think they are making a good decision in their driving or their financial decision. Or sometimes, beside the memory, they come over and say, they don't even know my names, or they can't converse very well. Their language is issue. And sometimes they come over with attention problems. So if you look at the thinking, we have a cluster of symptoms that usually detect by the care partners who come over. The main one is the memory. The second one is language. The third one is what we call executive functioning, or ability to solve a problem and navigate. These are the major three part of the thinking that they come over with us. Sometimes they come over with attention and concentration problem, and sometimes they come over with their not ability to see depth perception. But that's very, very rare. Most of the time, people come over with symptoms from the care partner notice or observe red flags related to really memory and language. And the third one is this executive functioning problem. So that's the dominant complaints that care partner come over with us. And sometimes the patient themselves, they come over. Our big challenge for us, Rachel, is by the time they come over to us, unfortunately, the brain is in big trouble already. So what we've been trying to do in the past, 5-10 years, at least in our lab, is trying to detect early signs of a brain problem. That's number one. And number two, identify people at risk for developing brain problem in the future with a focus on the thinking part, and trying to create tools and processes and strategy to do that. To identify people at risk and identify people with problem as early as possible. And the reason is, I can discuss with you more, because this amazing 3 breakthrough that happened in the past 5 years in the scientific community related to the thinking part of the brain, that unfortunately a lot of people are not leveraging these 3 breakthrough. And my job is to, through you talking with you, is to increase the awareness, is to remove any barriers for people to have access to leverage these 3 breakthrough that I can discuss in more details with you.
There's so many follow-up questions are coming to mind after what you've told me. I would say the first one is, I mean, correct me if I'm wrong, but I do get the impression that sometimes by the time patients reach a specialist like yourself, especially in territories where there's a long waiting time, and maybe I'm referring to the United Kingdom, I think in the GCC, we're quite fortunate in the sense that we do have private healthcare. And so things are tended to more quickly. However, we are also in a region that has a lot of, and I say this as somebody who has Arab heritage, we can be a stubborn type of patient. And I know, for example, people in my family who I might suspect that they have, let's say I'm noticing that there's memory loss, etc. And, especially older generation, they would say, no, it's just age, it's aging. And they just dismiss you and I'm not going to go to the doctor, etc. I'm sure you get a lot of that, even when the concerned partner or daughter or son or brother or sister comes along and alerts it to you. What would you say is the differentiation between, let's say, aging related memory loss and genuine memory loss? And I'm sure that's not the medical term, but what's the difference? Are there key differentiators?
No, there isn't. So there is no differentiations that are able to be picked up by a care partner or family member. By the minute a care partner, in my opinion, the minute the care partner have a smell of there's something going on, unfortunately, it's not age-related issue anymore. Right. So we had this concept in the past 10 years that there's age-related cognitive declines. It's that one, unfortunately, there is something, but you study it in a scientific way and you won't be able to pick it up. So let me tell you a couple of things related to your comments about the delay in the diagnosis. So let me start first with a major part of thinking problem. So the best way to kind of simplified thinking problem is categorize it into normal, or what we call a green thinking, red, and yellow. And that's exactly what I do in my clinic. So we have like a infographic of the person thinking, and we use the stoplights. So green is meaning your complaints or the observation detected by your loved one are not indicative of any difference than people who are same to you in age, gender, and race. So we call that, maybe you can call it age-related cognitive changes. Okay. And then that's the green. And in order for us to do that, there's certain things we try to do. Primarily, we do something called neuropsychological assessment, where we actually test your thinking parts and look at your results, and we compare them with people who are the same age, gender, race, and education level. Okay. And then the second part, which is the opposite of green, and that is red. And here you have brain disorders, or specifically brain thinking disorder, where you actually have lost brain cells, and that led to thinking problem. And the thinking problem is causing you to have disability. All right. And when the thinking problem causing you disability, then in the United States and even in English speaking country, we call that dementia. All right. So dementia simply indicate a thinking problem that affect your ability to live independently in general. Right. So we call that disability. So that's the dementia part. And then there's the middle ground. It's a color, and that's where you have mild thinking problem, or technical term is mild cognitive impairment. And that's where you have a problem with your thinking, but it's not severe enough to cause you functional and social disability, right? So these are the three kind of parts. So by the time patient come over to me and I diagnose them with dementia, the process, the neurodegenerative process, has been going on for at least 5 years, unfortunately. All right. And when they come over to us, they are in the moderate stage of dementia even, right? And that's in the United States. When we try in the primary care system in the United States, if we do some kind of early detection process, unfortunately, we're still picking up people with dementia, but it's in the moderate stage. So in reality, in the current system in the United States, and even in Europe, including UK, Western, the current system, can you imagine this? The current system miss 50 to 80% of people living with dementia, right? Like imagine that, 50 to 80%, all right? And that's been going on for almost 10 years, and I've been trying to figure out how we can fix it. In the current system in the United States and the Western world is missing almost 99% of people with mild cognitive impairment, all right? So this is our big problem for us, is how can we identify people at risk, but at minimum, can we do better early detection? So I'm going to tell you something that I'm not proud of, okay? I missed my father dementia diagnoses. And I think like, oh my gosh, I'm a really good scientist and a doctor. I missed my father diagnoses by, similar to everybody else, by 3 to 5 years, all right? And even though I was talking to my dad almost on WhatsApp, every once a week at least. So what I realized, if a doctor, who specializes in neuroscience cannot pick up a dementia diagnosis with his father, then that's mean my gut feeling, my direct observation are not sufficient. I have to develop tools and processes and strategy to do that. All right. So that's the big issue. Now I was in the United Arab Emirates in February. This is the first time I was in the Middle East since I left Syria in 1994. So that was my first time coming back, 30 plus years, 32 years. And what I realized is it's not just 50 to 80%. From my experience, exactly what you said, Rachel. The diagnoses is not just missed. By the time they come over to memory clinic, they're not in the moderate stage. They are in the severe and the very severe stage. So that's something I noticed different, at least from when from my own experience. I haven't looked into more peer-reviewed articles. So yes, we have a problem in the Western world and the Middle East about early detection of dementia for sure. And we have to develop tools and processes and strategy. And then the big questions that you raise is why, okay? So I think these are these are data our lab discovered, but they are based in the Western world. So United States centric, UK, ironically, we did some work in the UK and also in Germany and I don't know Germany, UK, and the US. There are, what we found, there's two factors that are the driving force, in my opinion, for this problem. Number one is ageism, okay? And number one is mental health stigma. So the major source is the stigma. There's a public health stigma for both from an aging perspective, ageism, like, this is just you're getting old, and from mental health. Oh my gosh, if people find out, they think I'm crazy, okay? Together, when you bring these two stigma together, you have the result that we discovered. How can you overcome that stigma? I learned my way is modeling. So this is why I'm talking to you. This is why I'm disclosing my father's situation. So I'm telling you, for me, I am at 3 to 7 times risk of developing dementia. All right. So whatever I'm doing research, I'm doing it for myself because I don't want to lose my brain. right? And so we have to figure out how we can destigmatize aging and destigmatize mental health or brain health. And how can we stigmatize them? I think modeling, storytelling, and any other stuff that we have been doing in other fields, like the way we destigmatize cancer in the 80s and destigmatize maybe infection, at least in the United States, the HIV in the late 80s, early 90s. So I hope that you can team up, because if anybody who can stigmatize or destigmatize this, it's going to be a great communicator like you.
What you mentioned about mental health really, really strikes a chord, because I would say, just through observation, I would say perhaps younger generations are more open about it because they're more connected in terms of social media, in terms of, even if there are free resources online, right, that you can go to check. But then when I'm thinking of older generations, my family, for example, it is very much what you said. It's like, oh, I'm not crazy. Even if it's just, perhaps you should see a counselor or a psychologist, or not even a psychiatrist, right? So there is definitely that stigma. And one could argue actually that they don't even connect mental health to something like dementia. Sometimes that connection is not, it doesn't come to mind, right?
Absolutely.
So it takes experts like yourself to actually raise awareness of this. And so you mentioned your father, and obviously I don't ever like getting too personal, but there was something that you mentioned, and the one being the misdiagnosis, which I'll ask about first, if you don't mind answering. If not,
It's okay, no problem.
But if you don't mind me asking, you mentioned your Syrian heritage, so I'm assuming, a proud Syrian father, man. Do you feel maybe he didn't want to highlight that anything was wrong, or as a patient, is he not aware? Because I'm curious to know if in the patient's shoes, are they aware, or it's just normal?
Well, it's complicated. So I'm going to tell you, so by the time you reach dementia stage, there's some function of your thinking that we call it agnosia, which is your inability to recognize things. So unfortunately, people, when they reach a level of dementia or mild cognitive impairments, some of them, they don't have that self-awareness, right? So that's a big factor. We haven't, at least our lab, we haven't zoomed into it more. It's very hard to study it. But my perceptions and from my experience, there is that self-awareness issue, all right? So for example, and this happens in a lot of thinking and emotional disorder. They take away your self-awareness in general, and if you are living in a stigmatized area, then it even take away your family's awareness. Okay, but below the neck, there's no problem. Like pain, pain in the heart, difficulty breathing, difficulty digesting, difficulty seeing, difficulty hearing. These are symptoms that people recognize sometimes falsely, and they don't feel that are going to take away any of their respect and their dignity. I think the brain, it does two things. It's number one, it take away your ability to self-aware. And in the same time, it make you worry that, oh my gosh, if I lose my brain, that stigma piece. So for my dad, for sure, his self-awareness, the problem with my dad is I didn't want to see what my mom was telling me. Like, actually, my mom and my sister would tell me, and I was like coming up with excuses after excuses in my head. I don't know why. I think I didn't want to see what I want to see, because this is very common in a human. We look for data to confirm our belief. All right, that's the major things of a human. So if your belief is like my dad is good, for whatever reason you don't want to, whatever, then you're not going to look for data to confirm. You're going to look for data to confirm, like, oh, everything is okay, and you're not going to look for data to kind of challenge your belief until it's too late. All right. And for me, what was the big thing that made me like, oh my gosh, how did I miss this, was the COVID. So this is a very common phenomena. If you have dementia, unrecognized dementia, then if I stress you out, Like I can stress you out by making you sick with pneumonia, making you sick with heart attack, making you sick with giving you wrong medicine, making you sick because I made you dehydrated you. Then if you have a vulnerable brain, that insult, that sickness can trigger something we call a delirium, which is an acute brain failure that it's very hard to miss usually, right? Especially if it show up in what we call an active delirium state, where you became agitated, anxious and stuff. And this is how we recognize my dad. My dad, I think he developed most likely COVID related, I have to think about it, but most likely he developed COVID related myocarditis that led him to heart failure. And he went to the hospital with a heart failure. And I'm like, yeah, we go. And he was having heart breathing problem for a couple of days. He went to the hospital with no medicine. Going to the hospital with no medicine, left the hospital with 5 medications, okay? And then everything's okay. My dad is a dentist. He's an amazing person. He gave freedom to me and everything else when that was not the norm, at least at the time when I grew up. So he left with 5 medications. Then he's a dentist, so he was responsible for taking his medication. One of his medication were anticoagulants, something to keep your blood thin. And he bled because he did not take his medication correctly. Cool. So he bled and he was very close to die. Then we took him back to the hospital within 2 days and 3 days. And there, the combination of him bleeding and having heart failure was just too much for him that he became so agitated. And that we're like, oh my gosh, this is delirium. And he didn't have the capacity to manage his medication. And this is how we find out that my dad had dementia. It's during that acute. Then after we did that, thank God for WhatsApp, I was able to help my mom how to manage that and figure out how to do it. She took over his medications. We learned all this stuff. We made sure it's the right medicine. I did everything that I developed in my clinical research. I was able to provide it to my dad and my mom through WhatsApp technology. And we were able to accomplish an amazing goal for my dad, which is he did not want to leave his country, even during Civil War. He did not want to leave his home, his neighbor. And we were able to do that and keep him in his life until last May. So for at least 6 years, the only we lost is that last 10 hours where he had a stroke and we had to take him to the hospital. But we were able to manage that and he died peacefully, I think, for the last 10 hours and kept his dignity and everything else. So I was able to manage him and help out. Obviously, my mom was the major person. She actually managed my dad on her own health expenses. But we were able to keep him at least in his community for the last 10 hours of his life. And I'm very, very happy with that. And now my job, if I have done that to my dad, even though he's in Syria, and make sure he gets advantage of these discovery that we have done here in the United States, then my gosh, I better make sure that available for anybody else. Doesn't matter if you speak English or not. I think the technology we have right now, it's allow us to make these breakthrough available to anybody on this planet with internet.
Thank you for sharing this. You did mention something quite important. You said you kept him there despite the conflict and all of this. And I think that's a huge mental health connection. There's something to be said about, and this is again with technology, I think this is what's making it amazing, because even in the UAE now, normally back in the day, it would have been normal just to travel for care. Whereas now the UAE especially is working and towards, that they're really investing in making the right healthcare available here on the ground, right? And there's something to be said about that, in the sense that the more stable everything else is, so living or environment, that helps, rather than just taking a patient out and disrupting everything. Because you mentioned that, there was already disruption between the medication and the agitation, as you said. So in terms of that mental health connection and keeping patients within their environments, what I would like to know is, when you do see patients now, what else can, well, I know that sounds really dismissive by saying alleviate symptoms, because it's not really alleviating symptoms, but what makes things better for the situation that they're in?
So that's bringing us over to the 3 breakthrough that at least one of them was produced by our team, and I'm very, very proud of it. So let me tell you these 3 breakthrough, because right now these breakthrough can change family's life, and society life, and obviously individual. All right. So I'll start with the big one that is very relevant to you and me, okay, in my family, which is what can I do to prevent my brain of developing dementia, and most commonly Alzheimer's disease and other related dementia. So right now, uh, for the past 5 years, but amazing peer-reviewed journal that summarized the amazing breakthrough that happens in the past 5 years, published by Lancet from the UK, by a commission from the UK, that showed that right now through lifestyle change modification and other really not very aggressive risk modification, I can prevent up to almost 50%, technically 45% of my future risk for developing dementia and cognitive decline. 45% in reality, it's 50%. So that's a major breakthrough, and I can zoom in into it. So that's one major breakthrough. The other breakthrough, what if you were unlucky? What if you, you did everything you could, but you still developed Alzheimer's disease, which is a specific type of dementia or mild cognitive impairments. Now, at least in the United States, there's 2 FDA-approved medications that can slow down your Alzheimer's disease by almost a third within just 18 months. We don't know what happened before, but within just 18 months, I can slow down your Alzheimer's disease cognitive decline, and I can clean up your toxic protein that is responsible for the Alzheimer's disease neurodegeneration by 1/3. All right, that's really that's the second breakthrough. And the third breakthrough, if you were very, very unlucky, like what happened with my dad, we didn't know about the lifestyle changes. We didn't know about Alzheimer's disease and the breakthrough, but he unfortunately developed dementia. So the third breakthrough that was done by our lab in Indiana, and then across the country, is we can now create a model of care that can keep your loved one with dementia in their community without burning out their care partner or their family caregiver. All right. So these are the 3 breakthrough. And the third breakthrough that I mentioned, we discovered that care model in 2006. I published the result with my mentor of that this is actually work. This care model can work, can reduce the behavioral and psychological symptom-related dementia, can prevent the caregiver stress. And we published it in JAMA in 2006. And then within 2 years, we used insight from Agile Science to convert that paper, that JAMA article, to an actual clinical program that my close friend of mine and family member received it in Indianapolis since 2008, January 2008. And then we started noticing, like, my gosh, why this model is not spreading across? So we figured out maybe scale. So we tried to scale that model more and more. And then we noticed, whoops, there's no demand for that model. No one knocked on my door and said, oh, come on, help me out. No health insurance came over. So we noticed, like, oh, there's no demand. And then obviously there's no demand because of the stigma. So we built coalition across all major academic healthcare medical centers, and with an amazing skills from the Alzheimer's Association, John A. Harvard Foundation. And we created demand, and we created an alternative payment model to support the delivery of that comprehensive dementia care model. And then in just 2 weeks, technically, no, not 2 weeks, on July 1st in the United States, there will be 400 organizations that will be paid to provide that comprehensive service for the next 8 years, right? So that's the major breakthrough. And their entire goal is provide psychoeducation, and I'll explain it, provide support for the caregiver, provide support for the patients to keep them at home. And the big support is they will, this health insurance or CMS or Center for Medicare and Medicaid will provide payment to the interdisciplinary team, the care coaches who they're supposed to support these dyad, the patients and the care partner. And on top of it, they will give them $2,500 per year for respite services that can give time for the caregiver to take a break. All right. So that's the major breakthrough that's starting in July. So we can zoom into that breakthrough. I can tell you the detail, but the details of it's very can be scalable unbelievably. Like my lab right now, I'm developing artificial intelligence care coaches that are going to be available to support the caregiver and the patient to implement what we're trying to do. So the scalability of it, all what you need is the internet, and obviously innovation to combine both the human care coach and the artificial care coach to take care of the caregiver. But So that's overall. So the breakthrough, if you are at risk, what can you do to prevent 45%? If you have Alzheimer's disease and pathology in the early stages of the disease, like unfortunately you need to be in the mild dementia stage or in the mild cognitive impairment, then we can slow down your disease. And then unfortunately, if you develop dementia, it doesn't matter the pathology, but you want to stay at your home, you don't want to burn out family, we can do stuff. So I can zoom into all of these three things from an action that the listener might be able to do it. So we can decide what you want to focus on. My suggestion is to focus on the first and the third. The second one is the fancy one, is the drug one and stuff, which will be all right. But I think it's complicated. You have to make sure you will get approved. It's very, very complicated, and it's not in the hands of the patients and family. But we can focus on what can you do to reduce your risk, like what I'm doing to reduce my risk. I'll tell you what I do. And what can you do if your loved one develop dementia? How can you optimize their quality of life, keep them at home, and not burn out with it?
And this is an amazing breakthrough that's going to happen, because the caregiver is often overlooked. But I feel one conversation between us is not enough. It's not going to be enough, because there's a lot more, and there's so much to cover, right? The caregiver, that's a really important angle, because as I mentioned, they are often overlooked. And I've known friends, family who've been through it, and it's immensely taxing on the person, not because of the burden of care, but it's also seeing a loved one and struggling with that. You mentioned obviously that you are taking steps to monitor yourself, so to speak. So I'm curious to know, because I think a lot of people might not know this. Dementia, well, first of all, actually, so dementia and Alzheimer's are often interchanged
in the past, but
in common language amongst just the public. So if there are key differentiators there, I'd love to hear those. But also I'm curious to know, given what you've mentioned and the care that you're taking, I'm curious to know, dementia, is it genetic? Is it epigenetic? Lifestyle factors? Is there no connection? I think a lot of people don't know what their chances are, so to speak. And obviously, we hear about precision medicine and personalized healthcare. And you can get your genome sequenced and find out what you're at risk at and whatnot. Is that something that patients can do in the area of brain health? So many questions together.
I got you. Well, let me because this is like personal. Let me just focus first on the differences between dementia and Alzheimer's disease. So in the early 70s, 80s, even 90s, the term dementia and Alzheimer's disease was used interchangeably. So in the last 10, 15 years, that's not the case. So I'll tell you specifically. So dementia is just a Latin or Greek term to describe that your brain has been failing for quite some times because of your thinking, and it's causing you a disability, right? It doesn't tell you why. It doesn't tell you what we call in biology the pathology of that, okay? Alzheimer's disease is one of the most common causes of developing dementia. Okay, so Alzheimer's disease tell you why you, or at least give you hypotheses why you start losing brain cells. So Alzheimer's disease is one of the most common causes of developing dementia. So that's one piece. The other piece, you can have Alzheimer's disease without having dementia yet. Okay, so you can have Alzheimer's disease, and you can in the research field, you can have Alzheimer's disease and you don't even have symptoms. Right? You can have Alzheimer's disease and you can have mild cognitive impairment. You can have Alzheimer's disease and you have dementia. All right. So it's very similar to what happened with coronary artery disease and heart attacks and heart failure. So in the 70s and the 60s, coronary artery disease and heart failure were used interchangeably. Now we know you can have a coronary artery disease without even symptoms. You don't even have a chest pain. You don't have a heart attack. So the same concept now is happening in dementia. We are able to disentangle this whole dementia and the underlying pathology. Right. So Alzheimer's disease is one of the common cause of making your brain cell die. And Alzheimer's disease, how does that happen? It's an interaction, it's a complex interaction of 3 dimensions. We know there is some genetic predisposition We know there's age. So we know Alzheimer's disease is tremendously go up in the incidence and prevalence with age. And we know there is some environmental factors. For example, if you have a high blood pressure, high cholesterol, if you get sick, specifically, if you get traumatic brain injuries, if you take certain medication that can actually tip you over and increase your chance of developing Alzheimer's disease. So that's the current hypothesis, is there's certain genetic, there's aging in particular, and there's something in environment through epigenetic or not. Together, they work together and make you have the phenotype that we call it mild cognitive impairment or dementia. So if you have a very high level of genetic susceptibility, I can like literally tip you over to developing dementia with just like make you sick with a urine infection or bladder, or at least making that show. So it's these three factors: genetic susceptibility, aging, and environmental insults are most likely work together to cause you to have Alzheimer's disease and dementia in particular. So let's just take that off the place. Let me tell you what are these risk factor modification. That will be stuff, and then I'll tell you what's the secrets in the dementia. What was the secret for keeping my dad at home as long. So the one for your risk or not, there's a lot of overlap. Simple thing: whatever is good for your heart is good for your brain. Whew. Okay, so keep your cholesterol as low as possible. Make sure you don't develop diabetes, whatever you can do with obesity modification or not, and make sure your blood pressure is below 130. Cool. So these are three things. Whatever. The second one, which we all heard about, correct? Like exercise, physical exercise. Well, thank God that will help my heart, help also my brain. What is that? 150 minutes of moderate intensity exercise once per week. All right. So that's the one. There's a one specific for your brain. We call it cognitive exercise. So there's now emerging that there's certain type of brain exercise or cognitive exercise that might help you out. The sixth one is make sure you don't have a hearing loss. And if you develop hearing loss, using hearing aid. So that's now an emerging risk factor. Hearing loss by itself is actually a risk factor for developing dementia and other Alzheimer's disease-related dementia. 7.1 is very, very common. It's really vision loss. Cool? So we call these sensory loss. So if your vision loss, that's a major risk. So try to protect your vision and correct them as much as possible. The 8th one is your sleep. So as much as this is emerging, trying to sleep 6 to 8 hours, a really, really good one and managed one. And then there's the depression. And this is very common now. We know depression, or specifically major depression, can lead to to developing Alzheimer's disease, other related dementia in the future. And then finally, there's some kind of smoking and environmental perspective. These are usually the 10 modifiable risk factor that I hate, by the way, but I have to do it. Like I'm telling you, like today, I had to go and burn 750 calories on that stupid elliptical stuff, but I have to do it because I don't want to develop dementia. Cool. So I have to do this stuff. So that's the risk factor. Obviously, the challenge for it is how can you change your behavior? And that is very, very hard. Our lab, we are using something called agile science to figure that out, but I'm not going to go over that. The second piece is, what about if your loved one, like what happened to my dad, have developed dementia and you want to keep them at home and you don't want to burn out other one? The magic there is what we call caregiver stress prevention bundle. It's very, very easy for me to say, but you need care coaches, you need other one to help you out. So these are very simple. Number one, you focus on the caregiver, the care partner. All right. So you might lose the battle with dementia, but if you manage the care partner, your loved one will be in good shape. So what does the care partner have to do? Number one, you are working as a care partner. My mom worked 3 full-time jobs taking care of my dad 24/7. Cool, like by default. So I had to convince her, and I failed, by the way. I failed doing that. I could not do that. Number one priority is for her to take 8 hours time off caregiving tasks, not just physically and psychologically. And that was the hardest things to do, right? The only thing she was able to take time off is when my sister came over from Lebanon or from France. And she was able to trust my sister. So she was able to take time off caregiving tasks, 8 hours in one bundle. 1 hour here, 1 hour there, unfortunately, doesn't work. It's actually make things worse. So 8 hours in one block. Second one, supportive group, which is very hard. That's where I was more of a supportive group to my mom, talking to her once every day. And we rotate between our other family members. So that's a caregiver, that's a supportive group. The third one is really develop a plan for crisis. So I knew what the crisis is going to face us. So number one, driving or no driving. Thank God we sold my dad's car. That was not an issue. Number two, trying to protect him from not being a victim of financial exploitation, other stuff. We took care of that. Number three was, should we go to the hospital or not? And should we do this screening tool or not? And number five, in the United States, very common, when should I bring over professional support home? Or maybe decide that maybe staying home is hard, so I might need to bring assisted living or something. And what should I do when he fall? What should I do when he gets sick? What should I do when he get agitated or aggressive? So these are, we call them crisis. Every family will face. We identify them and we develop a plan for them. If this happened, then you have to. And then the last thing is coaching. So I was primarily coaching my mom and how to cope with the cognitive or the thinking disability of my dad, the emotional disability of my dad, and his day-to-day function of my dad, and her own stress. So I was her coach. That's what WhatsApp gave me. I gave her tips. Mom, this is a battle you don't need to fight. Work it, and able to help her, coach her, and how to cope with these. That was the magic.
There's so much that goes into it, and again, it's the caregiver coaching support for those in a caregiving position is so crucial. The factors that you mentioned, when you were mentioning heart health and reducing stress and sleeping well, etc. And all I can think about is we're in a region where stress is high. Me as a journalist, I have crazy deadlines at times. Sleep is if I get 6 hours, I'm lucky. So I'm just thinking, oh, I'm doomed. And we're especially in the current climate, it's obviously hard to sleep. We're exposed to a lot of the news and updates that start coming out at 1 a.m., etc. And there's the social media timeline that we're in. Back in the day, we weren't exposed to news 24/7. So there's a lot of stress in general. But one thing I noticed you didn't mention, and this is probably a chance to debunk those wellness influencers out there. You get some people coming out on Instagram, wellness gurus, a lot of the time not really qualified, but selling a so-called brain food or a brain food supplement, etc. So what's the myth and what's the real stuff?
Yeah.
What's fake and what's real? Is there such a thing as brain food?
Yeah. So number one, I totally forgot about that one. So there's something called the mind diet. Okay. So not a supplement, the data there. I think the mind diet. All right. So mind diet is good. Let me tell you what's the mind diet. And it's, thank God, at least from the Middle East, it's compatible with our diet. So that's the good one. So primarily olive oils, cooking with olive oils, eating fish, and stay away from meat, eating berries, a lot of antioxidant, blueberries, strawberry, nuts, a lot of nuts, dark chocolates, not milk chocolate. So dark chocolates, it's amazing. And then in the United States, this might not be compatible with our culture. In the United States, red wine. So ironically, red wine, there's certain chemical, riboflavin, that actually responsible. So that mind diet, how can you coach and how can you do it? That's what works. The supplements, there is no data. We tried. I mean, I would love to do supplement because it's just taking a pill, correct? I would love it. If I can create one pill that fixes everything, that would be so easy. Like what we did with now is an injection. What we did with obesity, with GLP-1. Oh, awesome. We will keep looking for that pill, but so far for your brain, the mind diet, there is no pill. The question GLP-1, is it maybe can help with the obesity? Whatever you need to lose to create a really healthy BMI will be really awesome. Whatever the method that doesn't cause more harms. So yeah, the mind diet, it exists, but to the best of my knowledge, the supplement industry stuff, it's really tough. But I can't even convince my wife to stay away from these supplements. So I'm not, at least we can afford it. So at least we don't want, there's no harms from it. But so for now, they look like more of a placebo.
So doctor, as we wrap up this conversation, now it's interesting that you mentioned GPT at the very beginning. And I think we're going to end with GPT because look, every interview I have now, the topic of AI does come up. And it's usually, AI in healthcare and the benefits of AI in healthcare. However, in recent news reports, it's showing that over-reliance on GPT is actually making us think less. And there's something to be said about how our cognitive function is declining overall because we're no longer thinking, we're no longer thinking about very basic things. We're asking GPT everything. And I'm curious to know what you think about that, because you've mentioned the exercises that we need to do, the cognitive exercises that we need to do. I know the Harvard Business School Club has highlighted Sudoku, for example, as a great way to train, to exercise your brain. So what do you think we're in danger, like 10 years down the line, that we're just using GPT so much that we're just not using our brain anymore?
Yeah, so I'm relatively not, I'm 54 years old. Scare tactics with innovation have been always used everywhere. With any innovation, there's always pros and cons. So let's look about the obesity pandemic that led us to a significant problem in the Western world. And some of it came over from our innovation. Cool. But a big innovation is transportation. Right?
Yeah.
So for me right now, can you imagine? I'm right now in Indianapolis is 95 degrees. So almost 30 something in Celsius. I'm sitting here with no sweat at all. Cool. No sweat at all. So air conditioning have led me to stay here instead of walking the car. So everything you will have, there will be unintended consequences. We have to keep our unintended consequences and think what we do. I think so. ChatGPT for me, what helped me is just revolutionize information access. So now I don't need to spend all this money. I can talk with ChatGPT and work with ChatGPT to help me synthesize the literature very well. I have to know how to do it. What's the right prompt? Where are the hallucination or not hallucination?
Yeah.
So it make me more of a network thinker. Like my executive function may be really good. Is it going to jeopardize my memory? People thought that way with the phone. And I haven't seen pandemic with because your smartphone, people think, oh, now you don't have to memorize stuff. So let me tell you the bottom line for me. If you look at cognitive exercise, okay, there was a study that we were involved with, at least our university, published in the early 2000s, that found people who are 65 and older, and they did cognitive exercise for them. Ironically, what worked was not memorization related stuff. What worked is a problem solving and pattern recognition. All right. So what part of problem solving, pattern recognition, where do you see it? My gosh, as a social being, we need to have our emotional intelligence, social intelligence. And for that, we need problem solving strategy and pattern recognition. I don't think GPS will, in my opinion, it might give us a tool to leverage our ability to do problem solving strategy and pattern recognition. In the future, would that change us who we are as a human stuff? Yeah, the same way how these glasses have changed me, correct? Like if we did that glasses, I won't be able to see you. Look at that, I can't even tell. So these are tools that like humanity we've been engineer of tools and processes that allow us to adapt to our environment. And sometimes we screwed up in our environment, sometimes we don't. We hope as a species we'll be smart enough to gain the pros and create strategy to overcome the unintended consequence.
Just wondering, Dr. Malaz, do you have any closing statements for this one before we, until we meet again?
Well, yeah, the big thing is I want to end like there is no health without brain health. And if you lose your brain, see you later, alligator. You're gone. So there is no health without brain health, and there is a lot we can do that are relatively under your control. And I can tell you from my perspective, I'll do everything I can to pay back to the area where I grew up and invested in me in the first 2 decades of my life. So thank you for giving me the opportunity to pay back.
No, I mean, you're very welcome. Obviously, it's the Harvard Business School that's facilitating this. So it's very much thanks to them. And you know what? I just think next time we meet, hopefully it'll be in person, where you're here in the region somewhere and presenting to your colleagues, but also, maybe we can do something with the general public as well, so they can listen and ask their own questions as well. So we look forward to welcoming you here at some point.
Thank you so much. Appreciate it.
Thank you so much, Dr. Malaz Boustani. It's a pleasure to host you. And I'll probably just hand it over now to Alejandro for his closing remark.
So feel free to come in, Alejandro, at any time. But first of all, I would love to thank Professor Dr. Malaz for your amazing and inspirational, informative session. And I really want to thank Rachel for making this so personal to all of us by questioning and seeking knowledge from the guru himself. So thank you, Rachel, and thank you, Professor Dr. Malaz. And obviously, we want to make sure that you are also in the loop, Alejandro. So thank you for the introduction earlier. Just reminding the audience, thank you for being part of the Harvard Business School Club for the GCC Awareness Month on brain health and obviously brain disease awareness month in June. We also want to remind everybody that there is the Brain Challenge, a Sudoku link that has been posted on the Harvard Business School Club for GCC, and Alejandro also posted it on his LinkedIn. Please follow us and follow the Harvard Business School for other disease months that will be spread around for awareness and knowledge sharing. It's been a pleasure. Alejandro, would you like to have any final comments?
Again, thank you very much, Dr. Malaz. I really love your speech, especially because you are talking as a very important physician, but also as a human being with your own experience and your experience that you have with your father. I think that it was really insightful. And Rachel, for conducting this. This is really important that we all get together to increase awareness and try to decrease the diseases that we can have in the different fields. So this kind of events definitely will help for patients and for all of us. So thanks again a lot, and we hope to see you in the next session.